In the last video, I described how the United States has failed to control the COVID-19 epidemic. Being an optimist, I believe we can do better. To achieve our goal, we need to answer a key question. In a democracy, how can we achieve China's success? Unfortunately, as shelter-in-place ended, there was no central coordination of efforts. Public health and government institutions failed to encourage and train people on the proper infection control. In fact, many people believe the epidemic is a hoax and claim experts are lying to them. This represents a classic example of disinformation. Please watch the video addressing the dangers of disinformation in Module 2. Because of these conditions, large numbers of cases make testing, contact tracing, and isolation strategy nearly impossible to implement. We can't simply sit there and shake our heads. We all need to be part of the solution by leading. Now that you understand the problem, as healthcare professionals and concerned citizens, you must lead the charge and apply organizing methods to encourage everyone to faithfully follow the tactics required to drop R sub 0 below 1. We need to encourage 5 activities. Wear face masks. Avoid closed public spaces. Maintain 6-foot physical distancing. Avoid crowds and practice good hand hygiene. First, we all need to wear face masks in any enclosed public spaces. The evidence for their effectiveness is overwhelming. But seeing is believing. The scientists in this letter from the New England Journal used a laser light source to show how droplets spew from your mouth even when you are talking softly. You will note the dramatic change when the mask is worn.
Stay healthy.
Great.
Stay healthy.
Great. Less loud.
Stay healthy.
Good.
Are you recording?
Yeah.
Stay healthy.
Louder.
Stay healthy.
Louder.
Stay healthy.
Nothing.
There are multiple ways to obtain masks. You can make your own cloth mask, and I used the CDC template and made this hand-sewn mask shown in the upper left. This mask and many other cloth masks have a pocket where you can insert several layers of paper dish towels, the arrow, or a coffee filter. I also purchased humorous cloth masks from South Korea, masks from China, and ordered several handmade masks through Amazon Marketplace, bottom left. Our grocery store is also selling disposable surgical masks, bottom right. Remember the saying, I wear a mask to protect you, and you wear a mask to protect me. Wearing a mask shows that you care about others in your community. You should heed the advice of Pope Francis during his first public meeting since the onset of the pandemic. He warned against reverting back to individualism once the crisis fades. We all need to worry about each other's welfare. If worn religiously in public, we can continue to work, go to some commercial venues, and still drop the R sub 0 to less than 1. Face shields can also achieve this purpose, and my wife Kathy and I are now wearing them as an alternative to face masks because the face shield protects your eyes in addition to your mouth and nose. They do not become saturated with saliva and can be cleaned daily and reused. And at a dividend, you can see our expressions. 2. Avoid small, closed, unventilated spaces. Larger closed spaces are better, and outdoors is the best. This graph shows the relationship between space and ventilation with regards to the risk of being exposed to droplets. Whenever possible, enjoy the outdoors. And if you go to a restaurant, sit at an outdoor table. Finally, the longer you remain in a high-risk environment, the more likely you are to become infected. In general, avoid close contact for more than 10 minutes. Minimize being in public places. We have this plaque on our home. As never before, there is no place like home. 3. Maintain a 6-foot distance from others whenever possible, because droplets drop to the ground by this distance. 2 arm lengths is a good guideline for maintaining this distance. And be prepared to put on your mask if someone breaks into your protective zone. 4. Avoid large crowds whenever possible, because the more people, the more likely there will be someone in that crowd who is an asymptomatic carrier or even a super spreader. Depending on the prevalence of cases in your area, maximum numbers in a gathering should be 50 or less. In most cases, try to keep the number to below 10. 5. Finally, practice good hygiene. Wash your hands with soap and water for 20 seconds. Sing happy birthday twice. Cleaning of commonly used surfaces with a disinfectant is also advisable. However, to date, spread from surfaces has not been common. Remember, this is a campaign, but also remember we can no longer gather physically, and we need to use virtual campaign approaches. First, share personal stories of patients who are suffering from COVID-19. Remember Dr. Cece and the respiratory therapist. We each can share personal cases from the US, Europe, and the rest of the world. Find other like-minded champions using one-on-one communication. Write editorials, speak to your friends, and talk to our leaders. Post on social media and share the YouTube links I have included in the campaign packet that is part of Module 2. Hold virtual events to recruit others. We are all in this together. As never before, the world is an interconnected community. Our individual behavior impacts many others. And finally, remember, armed with the knowledge and understanding from this course, you too can make a difference. Thank you.